Guys, in this video we want to understand anaphylaxis, how to treat it. So what is anaphylaxis, guys? It is a life-threatening, potentially life-threatening systemic allergic reaction. So what is it? It's more like an allergic reaction. It's life-threatening. Here what will happen, there will be bronchospasm. That means you can imagine you will have to give bronchodilators as a treatment, right? So basically there is bronchospasm. The airway is kind of closed. There is circulatory collapse, right? Circulatory collapse. There is laryngeal stridor. That is noisy respiration. That's what you say, right? And there will be angioedema. Edema we understand, but what is angioedema? So they're saying the lower layer of skin and tissue. Okay. Anyways, now let's get back here. So basically, what and all are you seeing here? Bronchospasm you saw. There is circulatory collapse, laryngeal stridor, angioedema, urticaria. So that means some kind of rashes, right? They have shown here urticaria. Can you see that? Urticaria. So this person has hypotension. That is when it is becoming a shock, right? Whenever it is shock, you're saying hypotension. So they are saying there is a wheeze, stridor, those sounds, right? Angioedema of lips and mucous membrane. Feeling of impending doom, loss of consciousness, conjunctival injection. What is that? Flushing, sweating. Then what else? There's something at the bottom also. Urticaria, and then they're talking about itching, abdominal pain, diarrhea, cardiac arrhythmias. Okay. So this is all about anaphylaxis they are saying. So whenever you say it allergic, you will say it's IgE response, right? Immunoglobulin E. Basically this is the one associated with allergy. This is the immunoglobulin. So what will there be? There will be release of histamine. Okay. There will be tryptase. Other vasoactive mediators from mast cells. Okay. So what will these cause? These will lead to vasodilation. So that is why there is hypotension, isn't it? So this will lead to vasodilation, dilatation. Yeah. Okay. Increased capillary permeability. So what will happen if everything comes out? You can see all this, right, from the bloodstream. If there is permeability is more, edema, etc. Vasodilation, hypotension, there's bronchoconstriction, he can't breathe, etc. Fine. Do you know why all this happens, guys? So first of all, here you should say mast cell, okay? Mast cell, then IgE response. All this you will say. Now, why does it, because of what does it happen? So look at some examples, okay? Some foods can cause this problem like peanuts or some other nuts or fish or shellfish, that is seafood, milk, egg, soya products, okay, soy products. Then because of this, here they have shown you, right, insect bites, etc. Some bees, wasp, etc. You should be very careful from these wasps, right? Some chemicals can cause like some anesthetic agents like suxamethonium. Then penicillin, you know, you have heard of penicillin causing an anaphylactic reaction, haven't you? And then you have the, what is that? Latex, etc. So we'll just write the causes here. Common causes. You looked at food. You looked at some insect bite. Are you able to see? Food, insects, then drugs, chemicals. You should mainly here mention penicillin, okay? Penicillin. Then anesthetic, IV anesthetic. Anesthetic. That is suxamethonium, okay? Insects bite, you will talk about bee, wasp, sting, right? Then food, what did we tell you? Peanut, very common, you have to remember, not in India but abroad. Those children can't eat groundnuts, how sad. Not all of them, but what I'm saying is shellfish, then milk, egg, soy products, etc. Okay, let's get back here. After this, what will you say? These are the main things that you have to write, okay? What is anaphylactoid reaction, if somebody asks? Anaphylactoid means it is IgE mediated. Remember, no IgE is involved here. Again, here it can be because of drugs like aspirin, exercise, if you do some exercise, if it is too cold. Basically here it is not IgE mediated, okay. So, example, cause can be like aspirin, etc. Okay, anyways. Anaphylactoid means something like anaphylaxis, but there will be no IgE. Anaphylaxis means IgE response. Very important that you should know. Okay, this they'll ask in the exam, guys. Then clinical features, we told you what and all will be there, right? All this hypotension, urticaria, wheeze, stridor, all that you will tell. What else can it be? Okay, if you think this guy has an anaphylactic shock after eating some peanuts, what else could it be? What are the DDs for anaphylaxis? Anaphylaxis. Okay, what are the DDs? So you should know it can be other causes of hypotension, like it could be a cardiogenic shock, cardiac arrhythmia, vasovagal syncope, right? So those can be the differentials. Other causes of hypotension like cardiogenic shock or vasovagal syncope. Okay, then causes of respiratory distress. Why can respiratory distress occur in you? Some pulmonary embolus or status asthmaticus. Very good. And why can there be laryngeal obstruction? We're just writing here, guys. Otherwise, typing will take a lot of time. And you will get frustrated. So, let's put it here. So, status asthmaticus, pulmonary embolus. Causes of laryngeal obstruction like angioedema. So, obstruction. Edema will lead to obstruction of your larynx through which you have to breathe, isn't it? Then these three are seen. Okay. So generalized flushing. Why? So if somebody is having some rash, urticaria, or etc., you should not think that it is because of anaphylaxis. It can be because of some mastocytosis, pheochromocytoma. Pheochromocytoma is something to do with the adrenal gland, isn't it? Yes, pheochromocytoma, carcinoid syndrome, etc. So these are the DDs for anaphylaxis. So this carcinoid syndrome is because of some tumors, they are saying, paraneoplastic condition, they are saying. This will also have this flushing. Now just tell a recap of the differential diagnosis of anaphylaxis. Now, they will ask you in the exam only this point, let's say, differential diagnosis of anaphylaxis. Say, hypertension. Hypertension can be caused because of cardiogenic shock, vasovagal syncope, etc. Very good. Bronchospasm or difficulty breathing, etc. Pulmonary embolism. They're not saying bronchospasm. They're saying difficulty, respiratory difficulty. Can because of a pulmonary embolus. Or what was the other thing they said, guys? Status asthmaticus, asthma. Okay, status asthmaticus. Then laryngeal obstruction can happen because of some idiopathic angioedema, not because of the angioedema caused here, because of some idiopathic angioedema. Then C1 inhibitor deficiency. Okay, then generalized edema. Edema can happen because of generalized flushing, Generalized flushing can happen because of that carcinoid syndrome, pheochromocytoma, and one more thing was there, some mastocytosis, right? Go back here. Mastocytosis, yes. Yeah. So you have understood the anaphylaxis DD. Very good. Now let's go to the next slide and learn something more. Guys, basically, how will you investigate this condition? Is there any investigation that you can do? Can you go and find out what is wrong? Actually, it is more like an emergency, but anaphylaxis. So, can you investigate and find out if there is time? Okay. So, you can measure serum mast cell tryptase concentration. Okay. But you cannot distinguish between the anaphylaxis and the anaphylactoid. Okay. Anyways. You can do specific IgE tests. Like skin prick test. You'll give a small, if the person is not in this emergency condition, you can give a small prick of what exactly caused it, and you can see the reaction, right? The similar to your tuberculin test, etc. So that is what they are saying. You can know what the person is allergic to. If the person has this history of anaphylaxis, you can try to find out what actually caused it. Okay, now let us go to management of anaphylaxis. Are you ready, people? What are we looking at today? Anaphylaxis. Yes, now we look at management. That is how will you treat. Remember, it is a, what is it? It is a emergency. It could be life-threatening. It's an life-threatening and allergic response. So how will you treat? Let's give you a table here to tell you how to treat this anaphylaxis guide. So basically, airway, breathing, circulation, that's what they teach you in all emergency training, right? Airway, breathing, circulation. So you should maintain airway patency. That's what this point says. So that will make sure that you can give some oxygen and that guy can breathe if the airway is patent. First of all, do that. Prevent further contact with allergen, we ignored. Actually, the first thing they are writing is prevent further contact with allergen. If this person is a known anaphylactic case, he himself could be carrying epinephrine. He can be self-injecting epinephrine also. So those people can actually protect themselves. Anyways, if he has come in this state, then you are going to remove the allergen, contact from the allergen. You are going to check if the airway is patent. Then you are going to administer adrenaline. Very, very important to understand. Adrenaline is the one that is going to save the life. Adrenaline, emergency drug. It's also called as epinephrine. You're going to give just 0.3 ml. They are saying here. How much should you give? 0.3. Come on, guys, say 0.3 ml of adrenaline. That is 1:1000 solution. You will give IM, intramuscular route. Important. The cause of peripheral vasoconstriction. That's what they have written here. See, intramuscular route, important. Guys, are you focusing? Where are you? Are you able to understand? What are we looking at? Anaphylaxis. Very good. How much adrenaline will you give? I will give 0.3 ml, 1:1000 solution IM. Very good. 0.3 ml, 1:1000 solution IM adrenaline. You will repeat in 10-minute intervals. If initial response is inadequate, you should give IM route. Very important. If they ask you why you are giving IM, why don't you give IV? You will say, see sir, I will give IM because if I give IV, what will happen? Adrenaline will do vasoconstriction. Who will do vasoconstriction? Adrenaline itself will do vasoconstriction. Then how will the blood reach the body? Right? So you have to give IM. Adrenaline will do vasoconstriction. So adrenaline's job is to increase the blood pressure. Because that person had hypotension, you gave adrenaline so that he will go into normal blood pressure, that is his blood pressure can increase. That's why you're giving this. So it will cause vasoconstriction. So if you give adrenaline, it will cause vasoconstriction. How can he get the drug? Peripheral vasoconstriction will happen. And what else is this adrenaline doing? It is going to reverse the bronchospasm. That is, it is going to do bronchodilation. So the person can breathe better. Adrenaline is life-saving drug. It will increase the blood pressure. It will help in bronchodilation. Then you will give antihistamine. Who is the cause for all this nonsense? Histamine. So you will give antihistamine. What will you give? Chlorphenamine you will give. It blocks the effect of histamine on target cells. So histamine will be as it is, but it will, at least the effect of it is getting blocked, looks like. Chlorphenamine. Say chlorphenamine. Okay. Then glucocorticoids you will give. Steroids. What will steroids do? It will reduce the body's overreaction. So it will reduce cytokine release. So that is what steroids are doing. But you should be very sure this person doesn't have any infection or anything. Okay. Now let us go down here. Are you able to go down here? Then you will do some supportive treatment, like you will give beta-2 agonist. Why you will ask that person to nebulize, breathe that beta-2 agonist? Because you want bronchodilation. You will reverse the bronchospasm. They are not saying bronchodilation, they are saying more like we will reverse the bronchospasm. Then you will give IV fluids. Smart people. What will you do what will happen if you give IV fluids? Yes, the blood pressure will increase. So smart. Oxygen. Oxygen you will give, because this guy can have some laryngeal stridor, his laryngeal obstruction, etc., etc. Give oxygen, let him breathe, no hypoxia. Okay. Let's take a quick recap. What did we want to look at in this video? Anaphylaxis. Anaphylaxis is basically a life-threatening allergic reaction, which is because of mast cells, IgE response, immunoglobulin E response, histamines are released, tryptase is released. Tryptase is something that you can measure to know if the person is having this anaphylaxis. So basically all this histamine will lead to vasodilation. Vasodilation will lead to hypotension. So what are the causes? The causes can be food like peanut, fish, milk, etc., egg, soy, insects bite us like bee, wasp, drugs like penicillin, anesthetics like suxamethonium, etc. Then you have something called as an anaphylactoid reaction, where actually IgE, no, it's not mediated by IgE. Causes can be aspirin, exercise, etc. If somebody is having an anaphylaxis, always keep in mind the differentials, like for hypertension, it could be a cardiogenic shock or a vasovagal syncope. For respiratory distress, it could be a status asthmaticus or a pulmonary embolus. For laryngeal obstruction, it could be an C1 inhibitor deficiency or idiopathic angioedema, or there could be a generalized flushing because of systemic mastocytosis, carcinoid syndrome, pheochromocytoma. Carcinoid syndrome is that paraneoplastic syndrome. So clinical features, guys, clinical features, look at this, what and all will be there. Feeling of impending doom, loss of consciousness, flushing, sweating, wheeze, stridor, angioedema of lips, mucous membrane, hypotension, urticaria, itching can be there of the palms, soles, feet, abdominal pain, diarrhea, cardiac arrhythmias, etc. Okay, so these are the clinical features that you have looked at. And then we looked at how will you investigate. You can check the tryptase concentration, because the tryptase is what is released, right? To know what this person is allergic to, whenever the person is fine, only then you can do a skin prick test of all the common allergens. They can prick and check for which one this guy is actually allergic to. Then how will you treat this? Basically, it's an emergency. So look at this, emergency management of anaphylaxis. You will have to remove the allergen, ensure airway, give adrenaline 0.3 ml, 1:1000 solution, IM. Intramuscularly, you will have to give 0.3 ml. You'll have to write this in the exam, guys. 0.3 ml to 1 ml anyways. 1:1000 solution of this adrenaline you'll have to give. Then because it is caused by by histamines, you will give antihistamine. Which is the antihistamine they are talking about here? They are talking about okay, my handwriting is going bad. Chlorphenamine. Okay, chlorphenamine. You will give antihistamine. Okay, how much you will give if you want? You can remember glucocorticoids like hydrocortisone you can give, right, to suppress the immune, etc. Supportive treatment, you can give nebulization of beta agonists so that they can be reverse of the bronchospasm. IV fluids you will give so that you can increase the blood pressure, and oxygen can be given to reverse the hypoxia. How does adrenaline work? Why are you giving it intramuscularly? Because adrenaline will cause vasoconstriction. So if you give adrenaline, peripheral vasoconstriction, it cannot reach where your systemic circulation. So they are telling that you should give it intramuscular route. What will adrenaline do? It will cause vasoconstriction, so there will be increase in the blood pressure, and it will also cause the bronchospasm. If this guy's bronchospasm has happened, it will reverse the bronchospasm so that he can breathe better. So these are the very two important working actions of adrenaline. One is vasoconstriction, the other one is bronchodilation, or you can say reverse of the bronchospasm. That's it for now in this video on anaphylaxis. Bye bye.